Normally with the Trillium Show, I'm kind of the one choosing the content based on things that people ask me about and topics that I think are timely and relevant. Today we're doing something a little bit differently, and we've taken a bunch of questions from you guys, the listeners, the watchers, the people that follow the show regularly. And so it's going to be kind of an Ask Me Anything. So we've got a bunch of questions here that we're going to go over and get your questions answered directly on this show. If this is cool and popular, we'll do these again in the future. So for now, hope you enjoy this episode of the Trillium Show with Ask Me Anything. How do you know if you need a breast lift when you want a breast augmentation is a really common question. The common mistake that's made out there is women who don't want a breast lift, which is 100% of women, and are looking for some volume, end up with an implant that is way bigger than they need to try and compensate for the fact they don't want a lift. This is a terrible idea. Don't do that. Don't let anybody talk you into doing that. The easy rule of thumb is if you can lift your breast, well, if you can lift your breast up at all, you probably need a lift. But if you lift your breast up, if you can hold a pencil in your breast crease, stand in front of the mirror, no hands, then you probably are going to need a lift with your breast augmentation. If you can't hold a pencil under your breast, then you probably can get away with an augmentation by itself. So how do you know? Do the pencil test, and that usually gives you the answer before your consultation. So fat grafting to the breast is, it kind of ebbs and flows in terms of popularity. The answer to that question is yes, you can do fat grafting instead of a breast augmentation, provided that you don't want too much volume. The fat grafting is a great tool for small volume improvements that look very natural. So, but if you're looking for a significant change in size, so more than say a cup size difference from where you are to where you want to be, or you're one of these women who wants a very high round upper part of your breast, then fat grafting isn't for you. That's an implant look, and really only implants can give you a significant increase in size. So is fat grafting something we can do? Absolutely. Do I do it a lot? Not really, because most women want a look or a size improvement that's outside the scope of what fat grafting can accomplish. So the difference between a deep plane facelift on one hand and a traditional facelift on the other hand has to do with technique. What it doesn't have to do with is results. And I'll explain that in just a second. So a traditional facelift or a SMAS lift takes the SMAS layer, which is the connective tissue layer that's underneath the skin, which is where we want to put tension, because we don't want to put tension on the skin in a facelift. That's how you end up with bad results. We take that SMAS layer out in the outer part of the cheek, and we lift it up a little bit and rotate it to get the lift in the jowl. We typically do work on the neck and the neck muscles at the same time. With a deep plane surgery, the dissection and the amount of work that's done underneath that SMAS layer is much more extensive. So instead of just working out on the outer part of the cheek, we're actually going all the way down to almost the corner of the mouth and the jowl to lift all of that up, move it to where we want it to go, and hold it. So there's really no tension to it. The reason why I said at the beginning of the answer that the differences in results aren't really that significant is because we've actually looked, our society, there's been some research done in this that was published 10 or plus or more years ago, and the results for facelift surgeons, they took different surgeons that did different techniques, the deep plane or composite lift, the SMAS lift, the SMASectomies, and these other ones, and they compared the results. And all four surgeons, all four did different techniques, all four got great results to people who had no idea what happened. They just knew they had a facelift. And so the technique for your facelift really isn't as important as the technique that your surgeon is using to get a good result. So if you see good, this is why before and afters are important. If you see good before and afters on a surgeon's website and you go to that surgeon for that procedure, then how he or she gets there really isn't that important. What's important is the outcome. So, I've been doing this for 15 years and have used the high SMAS technique, have used SMASectomy techniques, have been using deep plane techniques for a couple of years now. And in my hands, my patients get great results with the deep plane lift. I got great results with a SMAS lift. I like my results, and I think my patients like my results with a deep plane better, but that doesn't mean the technique is better. So what are the differences? They're really technical. The end of the line, the proof of the pudding is in the eating. Look at before and afters before you decide on a surgeon, decide on a procedure. That's the most important thing, much more important than the technique used to get there. Yeah, I think that the technical part of surgery, yes, there's a fun enjoyment part to it, but it really is the enjoyment for us as surgeons comes from getting a good result. And so technique and how to get from point A to point B can be modified and is modified. And no surgeon does the same thing every time for years and years and years. You're constantly kind of tweaking things based on what you're seeing afterwards. And so you evolve as your results hopefully keep getting better and better and better.
Yeah.
I don't know how many times I've heard somebody ask a question of whether the belly button comes off and gets put back on during a tummy tuck. And the answer is 100% no. The belly button is kind of a funny little piece of anatomy. All the belly button really is a scar. That's where your umbilical cord was hooked up. That's where you were hooked up to mom in the uterus. And so it is a kind of a tubular scar. So it stays attached when we do an abdominoplasty to your muscles. And we tighten everything around the belly button. We make a little hole, make an incision around the belly button, do all of our work underneath the skin, pull the skin down, and then make a new little hole for the belly button to poke out. But your belly button stays attached. Now there are some instances where it is not going to live. If you've got a big hernia in the middle of your belly button, we may have to close the hernia, which kills your belly button, then we have to make a new one, which can look okay. It never looks like your real belly button, but it looks pretty good. But we leave that belly button attached so it can live and look normal and live a long, healthy life along with you and your new stomach. So this question, asking about, now we got a question earlier about belly buttons getting removed during a tummy tuck. Does the nipple come off during any breast surgery is probably the most common, does X, Y, or Z get removed and put back on? And the answer is no. The whole point of a breast lift, a breast reduction, a lift with an implant is to kind of move your nipple where it needs to go and then shape your breast around it. To do that, we have to keep it alive. And we have to keep it attached to breast tissue. So what we do, it's like origami on the inside. We leave that nipple attached to like a leash of breast tissue on the inside. We move it all around and then shape things around to shape your breast, but the nipple stays on. Now, if you've got really, really large breasts and we're having to do a significant breast reduction, there are some times we have to remove that nipple and put it back on so it doesn't die. If that's the case, it's called a free nipple graft. Your nipple's not going to be sensate. Most women that have to have that, their nipples aren't sensate anyway before the surgery because of how large their breasts are. But it's something we really try and avoid. There are lots and lots of options for breast augmentation, especially when it comes to size, when it comes to projection, so how far the implant sticks out from your chest. And this is something, in my opinion, that surgeons have done a terrible job of in terms of educating the public and women who are interested in breast augmentation. You choosing your size really is, because there are so many variables involved, isn't really something you got to worry about. The most important thing is you need to worry about what you want to look like when you're done. Do you want a natural shape, so a natural slope to the top of your breast? Do you want the top of your breast to be round? How large do you want your breasts in proportion to your chest and the rest of your body? Do you want to see a bunch of side boob, or do you not? And so it's having answers to those questions that really help your surgeon to determine which way to guide you to choose an implant size during your consultation that's going to help you accomplish those goals. But there's a ton of different measurements that we take in the office that help us choose that size implant. And even then, in the operating room, there's a little bit of wiggle room that we use. It's kind of like, I describe it to my patients, kind of like trying on shoes. We measure things out, you know, looks like you're going to fit in a 7.5, but then we actually try the shoes on, 7.5 might be a little too tight. You know, we have to go up a size. It may be that you know, 7.5 may be way too big, and we have to go down a size. And so there's some wiggle room in the operating room to get the look that you're going for on the back end, but being hamstrung by choosing the exact size implant in the office just kind of leads to heartache for both the surgeon and the patient down the road. So what's the difference between tummy tuck and lipo 360? One works and one doesn't. No, that's totally in jest. So lipo 360 is kind of this internet term that came about, you know, a couple of years ago for liposuction that goes all the way around your body. So upper and lower back, sides, flanks, love handles, stomach, where a tummy tuck really addresses the front of your stomach and addresses extra skin. Liposuction requires your skin to be in good shape and be able to kind of shrink wrap back down around everything once that fat is gone. With a tummy tuck, we do liposuction during a tummy tuck, but that skin is loose and hangs over your belt anyway, and so it's not going to bounce back, and so we have to get rid of it. So the biggest thing, the biggest difference is skin removal. The other is the muscle tightening that we do with a tummy tuck that really is what is responsible for giving that nice hourglass shape from both the front, or the front, and then the flat shape from the sides. So skin excess, muscle repair, probably the biggest difference between the two. Chances are, if you're somebody who's lost over 100 pounds and has a lot of excess, you probably have excess where you don't see it or don't appreciate it. And so the short answer to this question is probably not. What most patients who have lost a significant amount of weight, either with diet and exercise, with weight loss surgery, or with things like Ozempic and all of those GLP-1 agonists, what most of those patients end up needing is something called a body lift, or a belt lipectomy, or a 360, where we remove extra skin all the way around. Typically, for patients like that, you're going to have extra skin on your outer thighs, you're going to have extra skin in your backside, and it's not as apparent because the skin around the sides and the back isn't connected like it is in the front, where it kind of stops and then everything hangs over. So the best, I would go into a consultation expecting to have a body lift or a 360, and let your surgeon kind of guide you as to which procedure or combination of procedures is going to help you accomplish your goals. So this is a great question. Hooded eyes, relatively young, do we need a brow lift? Do we need a blepharoplasty? And the answer is it depends on your exam. Just like everything else in plastic surgery, a consultation is going to really be able to tell you what you need. When you're looking in the mirror, the thing to look at is where your eyebrows are. So if your eyebrows are sitting at or below the level of your eye socket, or for women, if your eyebrows are flat, then it's likely going to be that a brow lift will significantly benefit kind of how the shape and kind of awake look that you get with your eyes. A lot of times an upper lid blepharoplasty of varying degrees goes with that, not always. But if your eyebrows are in a good spot and all we're dealing with is a little bit of upper lid excess, then an upper blepharoplasty by itself is something that we can do and get a great result with. Mommy makeovers, tummy tucks, breast surgery. I think one of the keys with all of those is you really need to be done having children, and sure you're done having children before you have surgery, because everything is going to change with surgery, and you're almost 100% guaranteed to undo most of the work that went into getting you looking great with surgery by getting pregnant again. So if you're thinking about getting pregnant again, if you're not sure you're done, put off having any plastic surgery until you're sure, and then go for it. Cool sculpting, I'll give it a thumbs down. Humongous waste of money. Does it work? Sort of. The problem with cool sculpting, and I've talked about this on previous podcasts, is that the number of patients that would benefit from cool sculpting are very, very few in number. The number of patients who are offered cool sculpting or who have had cool sculpting is fairly huge, which is why the ratings and the patient satisfaction for cool sculpting is in the toilet. It really is not a technology that is worth wasting your money on. If you want fat reduction, see a surgeon, talk to him about liposuction, talk to him about body contouring, but cool sculpting, largely huge waste of money. Don't bother. Liposuction and skin tightening in terms of body shaping and body contouring really accomplish two different things. Liposuction really depends on your skin being able to shrink wrap back down around everything once we've removed the extra fat. And so just as a general rule, liposuction alone is for younger patients that haven't had their skin stretched out with significant weight fluctuations, with pregnancies, and just time causing your skin to lose collagen and not be as elastic. And so, like I said, liposuction generally reserved for younger patients. Skin tightening, skin removal, you can look at those things, whether it is non-invasive skin tightening, which on the body really isn't worth the time and money to do it, and then skin removal, you're talking about excisional surgeries like tummy tucks, like arm and thigh lifts. And those are for patients they may have extra fat, and usually do, that we remove with liposuction, but then that skin's not going to shrink back down, and so we have to remove it to tighten it surgically. And so that's where a lot of the combination procedures of, arm lifts and liposuction, tummy tucks and liposuction kind of come in, and why liposuction is a part of all of those procedures. Timing a breast implant replacement is something that's talked about a lot on the internet. And I think it's important to remember that what you see online is that breast implants need to get replaced every 10 years. And I think where that comes from is that the manufacturers warranty their implants for 10 years. So if something happens to them, if you get a spontaneous tear in an implant, which is pretty rare, that the manufacturers will pay to replace those implants up to 10 years. Most of them will. Once you get out past 10 years, the chances of having and we're talking about silicone implants here, what we call a silent rupture, so a rupture that you don't know anything about, goes up a couple of percentage points every year. Does that hurt you? No. Is that silicone going to leak into your body and cause some weird autoimmune disease? Categorically, no. But and usually what happens is if you do have a tear or a silent rupture of one of these implants, is that your body is going to recognize that, and the capsule around that implant is going to get firmer, and so you start developing a late capsular contracture, which is kind of a sign that there may be a problem with that implant. Do you need to go out and rush and get your implants switched out every 10 years like you're replacing tires on your car? Absolutely not. Most women have implants that far exceed the 10-year mark. I changed, implants that are way older than that out almost every week, and not because women are having problems, but because they don't feel like their breasts look good anymore and they want a lift. They want a new set of implants. It's either bigger or smaller. So do you need to get your implants changed every 10 years? Absolutely not. Watch them. If you're having problems, you don't like the way your breasts look, see your plastic surgeon and discuss what your options are, but don't feel like you need to run out and change your implants every 10 years. So what age is too young for a facelift? Really, the question is better is who is a candidate for a facelift? I think the important thing with plastic surgery, with cosmetic plastic surgery, is that we don't treat age. We treat anatomy. And a facelift is designed and does very well at treating the lower face, so jowls and jawline, and then most surgeons include the neck with that. So if you have jowls, a saggy neck, a facelift is a good operation. I've operated on patients in their 30s. I've operated on patients in their 80s, and operated on patients all in between that, in those age ranges, because of their anatomy. Typically, if you want to kind of averages, most patients start looking to have facelift surgery in their 50s and 60s. That's kind of the average age range for that operation, but could be earlier, could be later, depending on anatomy, but not age. The short answer is because the insurance companies do not care a bit about you, the patient. They care about your insurance premiums, and they care about keeping your insurance, as much of your insurance premiums as they can, without paying them out in the form of health care. That's the truth. The other part of it is that your insurance company doesn't see excess skin as being a medical problem. And for a lot of people, it isn't. Now, there are some patients who have real functional issues after having bariatric surgery, after having lost, 80, 90, 120 pounds, and they've got all of this extra skin, and they get skin breakdown, and they have chronic rashes, and they can't move around because this, just the momentum of that skin moving back and forth makes it hard to exercise. And they do have, insurance companies will cover some of that, but it is, if talk to any of the patients out there, if any of you watching have gotten insurance to pay for, post-bariatric plastic surgery, it's a slog to get them to pay for it, and you've got to jump through all sorts of hoops of physical therapy and having to be in the hospital and treat rashes and all this. And I can't even remember all the boxes you have to tick anymore, because we kicked the insurance companies out of my office a long time ago. It is really difficult to get that paid for. It's really difficult to get anything paid for by insurance companies anymore. So if you are having bariatric surgery, plan for skin removal, and just know it's probably something that's going to come out of pocket. Cellulite's a tough problem to treat. I've had these what we call subcision-based treatments, where you numb the area up, and you go in and you cut the little bands that anchor the skin to the muscle fascia that cause the dimpling. They've been met, in my personal practice, they were kind of okay results. The problem is those things, it's hard to get people numb. You have to go to either light sedation or an operating room to get those treatments done, and the results are okay. So do I offer them now? No, only because I don't really think the results justify the expense and the discomfort, but some people use them, they get great results with them, and so I guess there's the answer. It's a piece of shit. It's a waste of money. We've already talked about blepharoplasty. Blepharoplasty surgery is pretty common, and a lot of times people end up seeking blepharoplasty because they feel they look tired or sad or angry, and so we end up talking about upper blepharoplasty, lower blepharoplasty, brow lifts, fat grafting, laser treatments, and a blepharoplasty can really include any or all of those. You know, if your eyebrows are too low, women, if your eyebrows are flat and they sit at the level of your eye socket or lower, a brow lift makes a huge difference in kind of how your eyes look. Upper blepharoplasty surgery often goes with that and involves removing skin and occasionally a little bit of fat from your upper eyelids. Sometimes it involves adding fat to your upper eyelids. If your upper eyelids are hollow and your eyes look hollow, we can actually add fat to your upper eyelids to help soften that out, and it really makes a huge difference. For lower eyelids, younger patients usually show up needing and asking for blepharoplasty surgery because of eyelid bags. And oftentimes it is either because of the way that they were born, it's a genetic thing, their parents look the same way, but they don't have real high cheekbones. They don't have a lot of volume in their cheeks, and so they get eye bags really early. And we're talking about 20s and 30s early. And so blepharoplasty surgery to kind of smooth out those eyelid bags often involves a little yin and yang. It involves taking a little bit of fat out from the inside and then taking fat from somewhere else and injecting it on the outside of the eye, under the skin of that tear trough or eyelid bag, to help smoothing things out. And volume addition, when we talk to patients about lower blepharoplasty and putting fat back, a lot of times they're caught aback because they think it's that fat needs to be removed, but we actually have to balance the two things, the inside fat and the outside fat, and oftentimes we end up, almost all the time now, end up putting some fat back, and then we treat the skin either with a little bit of skin removal, or what's most common now in my practice is using a laser to tighten that skin of the lower eyelids. So blepharoplasty can be pretty complicated. If it's something you're interested in, please give me a call. We can have a consult and we can talk through each of these different things and decide which is the right procedure or combination of procedures for you. Wow. So why did I choose plastic surgery? Probably because I'm masochistic. I enjoy being in training for years. No, I went to medical school with the thought of being a surgeon and wanted to be a pediatric surgeon, actually. And it wasn't until my general surgery rotation, when I was an intern, some of my friends were in the plastic surgery program, and I got to see all of the stuff that they did. And I was like, man, this is really awesome. Like it's all these like really intricate, delicate little surgeries. Of course, it was like they were doing these at like 3 and 4 in the morning on a Tuesday, but they were still, putting fingers back on and, facial fractures. And I mean, it was just really cool. I also fell in love with the pediatric side of plastic surgery, so cleft lip and palate and all of that. And I said, that's what I'm going to do. I've since done all the training, did 5 years general surgery, 2 years plastic surgery, year of facial surgery fellowship at Stanford, and it's all been great. I love what I do. It is the intricacy, the delicacy of doing everything, the attention to detail that you have to have as a plastic surgeon, because everybody sees what you do. There's no hiding. There's no stitch that can't be just right because you see it. Especially working, doing a lot of facial surgery, which is over half of what I do, there's no hiding any of that. It has to look good. It has to be right. And it just satisfies my kind of type A personality. My favorite surgery to perform is whatever I'm doing next. I get that question a lot. And I love plastic surgery for the breadth. I could be doing breast cases one day, I could be doing a tummy the next day, I could be doing a breast and a face on the same day. And so the being able to kind of operate different parts of your brain, different parts of the body, is really gratifying. But with that, the focus is on the patient that you're operating on right then. So do I have a favorite surgery? Facial is probably my favorite surgery, but the surgery that I'm focused on is what is the person who's on the table or is going to be on the table, tomorrow, because that person deserves, me at 110%. It's kind of an interesting question. What does skin resurfacing do to your aging process? Kind of an interesting question. And I think where whoever asked this is coming from is that they rightly know that laser resurfacing, chemical peels, things like that, do cause your skin to thin. And thin skin is one of the things that we try and combat with all of our anti-aging treatments. And so kind of taking that to the next logical step, thin skin makes you look older, but a lot of times when we're doing resurfacing, especially deep resurfacing, it's a balance. We combine, and I do combine treatments. So we'll do deep resurfacing, but then also do fractional resurfacing to help build collagen. So while we're thinning the skin from the top, we're building it from the bottom to help grow collagen. We also have patients on growth factors to help build collagen throughout this process, so we're not thinning their skin artificially over time and making them look worse. Now, you can see people who have not done that and whose skin is paper thin from having one too many CO2 resurfacing procedures. But I think if we're careful and we plan our procedures right, we avoid thinning that skin and making it look bad over time and just get you looking great. So do I prefer using drains or drainless tummy tucks? In my practice, I've done both. I continue to do both. I prefer drainless tummy tucks. I do more tummy tucks with drains because the complication or the negative outcome that you're trying to avoid with a drain is a seroma, fluid collection under your skin. And drains largely prevent that, in my experience. I've done drainless tummy tucks. I do drainless tummy tucks when we're not doing a lot of liposuction, when it's mostly skin removal, and they work really well. But I found that in my own patients, when I'm doing a lot of liposuction on an abdominoplasty and avoid using drains, there's a lot of fluid that ends up trying to come out of the areas we've done liposuction in, and we end up, without a drain, developing a seroma. So I typically will use a drain when I'm doing a lot of liposuction with an abdominoplasty. Is a Pope Catholic? Of course I have a surgery playlist. I've been building my surgery playlist on Spotify for the last 10 years. It's up to like 900 something songs. And you can check it out. It's public. We'll link it in the show notes. But it's got everything. If you like Sinatra, there's some Sinatra on there. You like Dave Matthews? We got that. You like Britney Spears? We got that. You like a little bit of EDM dance music? We got that. You like some old school country, Hank Williams Jr., David Alec, we got that too. So, it's very eclectic. It kind of bounces back and forth. You can have like Drowning Pool, and then it jumps to Sinatra, and then Britney after that. So it's cool, it's fun, it keeps it lively in the operating room.